These are our case data by race and ethnicity. And these are compiled from all of our jurisdictions again. And we can see differences. In January 2021, this winter surge, we saw a lot more Hispanics, a lot more Alaska Natives and American Indians through that surge who are infected.
Why has there been such a discrepancy?
Much of this is social determinants of health.
And what do you mean by social determinants of health?
I mean where people live, where they work, where they play, where they pray, how they have access to health care. That's not uniform in this country. And that is all played out in these Hispanic populations. More and more disease, more and more death, and in fact, more and more long COVID.
And also in Black populations?
Black populations, very same thing.
Much higher rate of getting the disease and of dying.
Of dying from the disease, much higher rate of the high-risk conditions that put you at risk for the disease, less access to care to begin with.
What is the CDC doing about that?
In April of 2021, I had just been on the job for weeks. We declared racism a serious public health threat, and we have been working hard on equity in this agency. And we're looking at investing in public health workforce, in data collection.
I spoke to a pastor in Minneapolis whose congregation was predominantly Black, and he said to me, my congregation may not listen to the head of the CDC or the head of the NIH, but they'll listen to their pastor.
Indeed. Indeed. Well,
are you reaching out to these communities?
Absolutely. And in fact, this is really part of what we're trying to do in our public health workforce. Our workforce has to be as diverse as the communities they serve. If we had had public health workers in the Minneapolis church who had been talking about sugar control and talking about blood pressure control and talking about, risks for maternal mortality and sort of delivering health, when it came to vaccinating that church, they would have been the trusted messenger already. We need public health workforce doing all of that work now. And in fact, I firmly believe that it will help not just vaccination for COVID, but it'll help level the playing field in all those places that they're not level in terms of diabetes, hypertension, stroke, cardiovascular disease, and many other things.